We're going to look at the anatomy of the kidney channel from kidney 1 through kidney 7. Let's actually start at the spleen channel though, at spleen 3, just to find a few landmarks. At spleen 3, I can push up against the first metatarsal, and I can go down over the abductor hallucis muscle. We'll come back to that muscle in just a second. But if I push into spleen 3, I'm pushing between those two structures. If I were to advance a needle, that needle would travel to the flexor hallucis brevis muscle. That's a muscle within the spleen sinew channel, and it's actually at the deepest myofascial layer of the plantar surface of the foot, really right up against the bone. From there, I can go back to abductor hallucis, and note that I'm now strumming across a muscle that is within the kidney sinew channel. This is at a superficial myofascial plane. It's more inferior. We'll look a little bit more at this layer, but for now I'm just going to strum through the abductor hallucis muscle. I might note that there's some taut bands there. There's a little tension. I can feel close to what might be a trigger point. Yeah, like right in there. I might even elicit a local twitch response. But as I continue through the abductor hallucis, I eventually run into kidney 2. So kidney 2 would be at the posterior border of the navicular bone in the abductor hallucis muscle, and it's actually where a branch of the plantar nerve innervates that muscle. So this is a motor entry point, a point that's innervated by the medial plantar nerve. As I go a little bit more towards the calcaneus, I eventually butt into another very reactive part of the abductor hallucis, and this is where I locate kidney 6. Many other people do too, especially Japanese traditions. But briefly, let's look at the standard location. That's going to be more like one sun below the malleolus. It's often described as being between two ligaments, but it's actually tendons. It's the tendon of the tibialis posterior, which creates the roof, and the flexor digitorum longus, which creates the floor. So if I go over the tib posterior, this is a muscle that in my mind is really part of the spleen sinew channel. So it continues down into the foot, attaches to that deepest plantar surface, has fascial connections into the flexor digitorum brevis muscle, all part of the spleen channel. Spleen 5 would be highly associated with that muscle. The tibialis posterior creates the floor of spleen 5. I can often affect the tone of tibialis posterior at spleen 5. If I follow tib posterior up, it's going to start to dive deep towards the deep posterior compartment of the leg at spleen 6. Frequently I can elicit fasciculations when I needle patients at spleen 6, and the foot will go into a little supination, or I'll even see or feel the tibialis posterior tendon tighten. So part of the spleen sinew channel, even if I go on the other side of it, between it and flexor digitorum longus, I don't feel like the anatomy really matches the kidney channel, but I also just don't get as good a clinical results when I needle it there. But back here, it's much more reactive. It's over the abductor hallucis, and it's actually where the plantar nerve travels through the abductor hallucis en route to the plantar surface of the foot. So highly connected to the plantar nerve at that point. Going from there, I can start to palpate over the neurovascular bundle, feeling the tibial artery, nerve, and vein. I want to be delicate here and not press too hard, but it's very notable there. So now I'm at kidney 3. Kidney 3 would be basically pressing up against the posterior border of that neurovascular bundle. From there, I can go down and a little bit posterior. I'm at kidney 4. That travels a little ways away from that neurovascular bundle. It's more into the soleus muscle. And then kidney 5, I'm back up against that posterior border of the neurovascular bundle. And there's also a branch of the plantar nerve that travels to the calcaneus from there. From there, I can go back to kidney 6. And again, that's where that plantar nerve travels through the abductor hallucis. So from here, let's go to kidney 1. We're going to, again, palpate through the abductor hallucis. I want to go over that muscle to the lateral border. From there, I can press lateral into the flexor digitorum brevis muscle. I can even go onto the flexor digitorum brevis muscle and note that this muscle, like the abductor hallucis, is part of that most superficial myofascial layer of the plantar surface of the foot. And I can feel the tone of that muscle. Note that it's part of the kidney sinew channel. Strumming through it, looking for trigger points. I might even needle that muscle going from the medial border into the belly of the muscle. But I want to take note for now that the plantar nerve that traveled through the abductor hallucis goes deep to the flexor digitorum brevis, really just underneath it. And as that muscle ends, the plantar nerve becomes very presentable, very accessible there. From there, the tendons continue into the toes, but the muscle fibers end, and I have really good access to that, especially the medial branch of the plantar nerve. So kidney 1 affecting the plantar nerve, kidney 2, where it sends out a branch to innervate the abductor hallucis, kidney 3 up against the neurovascular bundle, kidney 4 slightly posterior, not directly as in contact with the tibial nerve, kidney 5 up again up against that neurovascular bundle and where there's a branch of the plantar nerve that travels off, and then kidney 6 where the plantar nerve penetrates through the muscle en route to the plantar surface of the foot. So last one we'll look at is kidney 7. We'll again note this superficial myofascial layer of the plantar surface of the foot, abductor hallucis, flexor digitorum brevis. Both muscles highly connected to the plantar fascia, especially the medial portion of the plantar fascia, which is really what people mean when they talk about the plantar fascia. The lateral band is along the urinary bladder channel. But that whole fascial structure of the abductor hallucis, flexor digitorum brevis, and plantar fascia blend into the periosteum of the calcaneus, especially from the medial tuberosity, then travels up and connects with the soleus muscle. So if I continue up through the soleus, I bump into kidney 7. So kidney 7 into the soleus muscle, affecting this deepest, most myofascial plane of the plantar surface of the foot, part of the kidney sinew channel. Compare and contrast to the one that's more up against the bone, the spleen sinew channel, that then travels more anterior right up against the tibia. So 2 different layers. Sandwiched between that would be the liver sinew channel, but 2 different layers that travel down into the foot.